Aloha to our Kūpuna. My name is Russell Kim, and I'm a dentist in Kaneohe, and I want to thank the Kūpuna Network for allowing me to share with you a little bit about oral health and why it's so important to our overall health. First, though, what I'd like to say is that dental offices on Oahu and in our state are open. All the dental offices that I know have followed the CDC guidelines to prepare their office and to make it as safe as possible. And in my office, I have been seeing my Kūpuna, and we have not had any problems or any issues. So I want to invite all of the Kūpuna to go and see their dentist. So why is oral health so important? Besides being able to eat and enjoy your food, your ability to speak, swallow, and smile is related to your oral health. We know that in order to keep your body healthy, good nutrition starts with a healthy mouth. Research shows that chronic gum disease can place you at a higher risk for chronic health issues, including heart disease, diabetes, stroke, and even Alzheimer's. So what can you do? First off, keep your mouth clean. And what does that mean? It means that when you're at home, and I know a lot of you folks are staying home, is to be very diligent with your home care. That means brushing and flossing. And even those that don't have teeth or have dentures or even partial dentures, you can brush your gums and then that way you'll be able to have a healthy mouth too, okay? The second part is to visit your dentist regularly. Now, visiting your dentist regularly, what I tell people or what I ask my patients and when I talk to people is to have a dental home, someplace where you can go that you have a good relationship with the dentist, the dental hygienist as well, and then that way you feel comfortable going. And my recommendation is at least going to your dentist at least twice a year. And the purpose is so we can catch problems before they turn into big problems. A lot of times, people don't go to the dentist until they have swelling or they're in severe pain. And a lot of times, maybe the dentist's office is closed, and so they end up going to the emergency department, emergency room at the hospital, which then takes away resources from the hospital and healthcare there as well. So have a dental home and visit your dentist regularly. The third step is to make healthy food choices. Some of the good foods that we eat is not necessarily the best food for our mouth. Sugary foods, acidic drinks, sodas, candy, even white bread or soft carbohydrates, that can lead to severe tooth decay down the road. So eat nutritiously, whole foods, a plant-based diet is pretty popular right now. So a plant-based diet, whole fruits and vegetables, those are great things for you to snack on and to eat on a regular basis. So pick good, nutritious food. Third is to avoid any kind of tobacco use, that be it smoking, even smokeless tobacco, chew or dip they call it. Those kind of things can really increase your risk for oral cancers, makes your mouth condition more prone to getting other kinds of oral diseases as well. So those are the 4 things that I would recommend that you can do right now. So the biggest health issues that I see in the elderly in my practice are 3 things. First is dry mouth. Now dry mouth, the technical term is called xerostomia, but dry mouth can be brought on by not only as you get older, our bodies don't work well, and our mouths can be affected by that also. So the saliva, when we have dry mouth, the saliva output in our mouth decreases. And so because your saliva is actually a buffer or a rinsing solution for your mouth, if you don't have that and it's not working properly, food particles can get caught in between your teeth, and that can lead to cavities. I've had patients that come every 6 months, and at the 6-month appointment, they were fine. The next 6-month appointments, fillings were popping out and crowns were popping out because they had dry mouth. And the dry mouth causes cavities underneath the old restorations or crowns that they do have. One of the major causes of dry mouth is your medication. And as we get older, we do take a lot of medication, and the medication, almost every medication that you take can lead to dry mouth. So that's what I see primarily in my dental offices, that elderly Kūpuna taking medication and then they change the medications that can lead to increased rates of cavities. And the cavities don't happen, it happens in a specific place, really on the root surfaces of your teeth. As you get older, your gums tend to recede, and when the gums recede, the root surfaces get exposed above the gums. And when that happens, the root surface is a lot softer material than the top part of your teeth, what we call the enamel part of your teeth. And so it's real easy for the acidic foods that we eat or food just getting caught in between your teeth that can lead to cavities, and it happens, like I said, pretty rapidly. The third thing is chronic gum disease. Now, chronic gum disease, as you get older, it's a little harder to take care of your mouth and to be diligent about it. Sometimes we forget or we think we did it and we didn't. And so gum disease is probably one of the biggest issues that I see as well. And when the gums recede, more food particles can get caught underneath the teeth. And gum disease also can affect our overall health. The bacteria in your mouth, because of the bleeding gums and the inflammation that you have, it can allow the bacteria to enter into your bloodstream, and the bacteria can get lodged into the linings of the arteries of our heart, in our brain, and in other areas, and that can lead to major health issues. The inflammation alone that is caused by the gum disease can adversely affect people that have diabetes. It makes it harder for them to control their diabetes medication, and with the inflammation added to diabetes, your healing in the rest of your body is also diminished. So healing of your gum disease is hard as well when you have diabetes, when you have chronic gum disease. So a lot of this is, how should I say, it's not really your fault or Kūpuna fault. When you're younger, preventive dentistry was never really emphasized. And so a lot of people don't realize how important it is to your mouth. So a lot of Kūpuna still think that losing a tooth here or there is part of the aging process, which we know doesn't have to be. And so my goal is to help our Kūpuna keep their mouth healthy for as long as possible so they can enjoy life more abundantly. Thank you.